This year, CVNA annual global health trip had a very special purpose. We went to San Vicente after the tropical storm hit the island, and we wanted to provide the support to our community. Unfortunately, we couldn't come exactly when they happened, so we're coming 2 months after. But one of the things that we first experienced when we arrived that literally struck us is just how resilient people of Cape Verde are, like how resilient people from San Vicente are. In just 2 months, so much already had been done. Life wasn't perfect, but it felt like things were close to normal. The needs that we found were just like chronic health issues that already existed in San Vicente, that already existed in, say in Cabo Verde, but so working with the nurses, alongside with the nurses, with support from the hospital and the community health centers, we visited the communities and especially communities that were affected by the storm as well. Rewarding also special thing that happened during this trip that, we didn't do before, that we have not done before, was going to people's home. Just being welcome in just being welcome into their home and listening to their stories and hear the challenges that they face every single day was something that was very rewarding to see. We also visited the areas that were affected by the storm, and then we can see how the storm had just damaged the roads, and then we just being there, we could just feel and imagine how difficult it was for both parties, like the party that were providing the help, but also people receiving the help, how challenging the whole experience, must have been. Another powerful moment of this trip was that we visited a elementary school. We held sessions to talk about anxiety and stress with children. It was really fun and rewarding just to hear the kids talk about their experience during the flood, but also ways that they dealt with the stress during that situation. We provided them with tools, how to breathing exercises, and also provided them with stress balls. We saw a couple of them being used in during recess, as a soccer ball, but it was really interesting to see and very powerful and rewarding experience. As always, we try to connect with community in different ways, and we connected with another orphanage in San Vicente, which is ICA, and we also saw how the storm had hit them. And for instance, the vehicles that they used to transport children to school or to other activities were completely destroyed. We had brought supplies with us to help them set up an infirmary that they can use for children when they're sick instead of taking them to the hospital for little things. And also an infirmary that can be used by providers that visit them, like nurses and other healthcare providers, for simple things for the children. And that was also something that was pretty cool. Our original plan was to go to Praia, just like previous years. However, we changed the plan after the storm, and so we had sent supplies in prep for that. This year we received a donation from a company called Darko. They make shoes and boots that support foot health. So it was about $10,000 of supplies that we sent to Praia, and we had a physical therapist that came with us and actually had to leave us a little bit on the earlier side to come to Praia to do the education to nurses, physicians, and also to other physical therapists how to properly use these shoes and boots. Went back to SOS, which was a site where we established care last year. This year was slightly different because it was a weekend, and then it was towards the end of our trip. We didn't have the opportunity to do exams like we did last year, but we had opportunity to be with the kids, just talking to them, playing with them, and just also having the time to talk with staff about their job and what they do, and then how SOS actually works. We always have new travelers. It was really good for them to learn about SOS. It was during this conversation that we had this idea that with the holidays coming up in a couple of months, we thought we can just create a Christmas wish list. Each kid will provide us with a wish created a wish list, and then they will provide it to us. And we will have our community back in Massachusetts, back in the U.S., buying these gifts for children. I think will be a good way not only to support them, but also it's a good way to continue to work with kids even not being here. It's a little bit more than providing a pair of shoes or a toy to kids, but I feel like it's a way to provide them with with opportunity just to say, my dreams matter, I matter. Is it going to be a better holiday experience if they have something that they really wanted? Of course, but it also allows it helps with their emotional health in a way. I believe. That for us is what CVNA is all about. It's a little bit more than providing aid when we come. It's working with our Cape Verdean community here. It's acknowledging their needs and then working together and building community and then just strengthening our people as we continue to do this work.
The members of our association gave their testimonies and spoke about their experience of participating in the mission we carried out in Cape Verde.
I came with the perspective of comprehensive community development perspective, and I came with no expectations. And what I found was that the work that the Cape Verdean Nurses Association is doing is just amazing. And I look forward to working with them in bringing in more money to continue their partnership with Cape Verde and the collaborations.
I've been here before with the group, with the association, and I've always learned a lot with the community, with the healthcare professionals. I take a lot to bring back home and allowing me and my colleagues to give back here in the community. It's a blessing, and I'm hoping to come back more times and help the community.
So this is my third trip with CVNA, and it's always a great opportunity to meet other healthcare professionals on the trip and also here in Cape Verde. I was blessed this year to see a different island, São Vicente, where we got to see the devastation of the flooding and how it impacted the people in São Vicente. And it was very eye-opening just to see that a lot of things were affected and they're slowly recovering. But the people in Cape Verde are very resilient, and it's just awesome to see that.
Absolutely wonderful experience to meet the people there, such resilient people. Really impressed with how well they're bounced back, but obviously they continue to need our community support, and very grateful for the relationships that we've built on this trip, and we look forward to returning to São Vicente and working not only with the nurses but the community that was very welcoming to us. So very grateful for that, and I thank all the group that came with us.
As always, every time I come, it's a new experience. The big part being forming new relationships with the people I come with and the people that are here. And part two, that I always learn something about the community here, myself, and that's why I keep coming back.
It's been a really amazing opportunity to experience the culture here, and it's been very eye-opening for me to witness people in their homes and experience the communities and see the needs and the way that we can help them as healthcare providers. And I really appreciated my time here and the people that I've been able to work with.
I think the more that we are given the opportunity to come over and do the good work and have the ability to support the staffs of the hospitals, of the health centers, of the home care agencies, we'll be able to do the best for the patients that are here and allow for them to experience really good health care and allow us to be able to help to allow for any of the healthcare to become better here in Cape Verde.
I feel very, very thankful, very blessed to be here. My first time here. I'm, part of this organization, and I just feel that we were able to lay eyes on the community here in the hospital system and see what the patients and what the staff are in need of most. And I think that we can take all of that knowledge, bring it back to us in the United States, and figure out how we can best help this beautiful country.
It was a great experience and opportunity to learn a lot,
seeing how the nurse and the other interdisciplinary team work together to provide the best for the community with the scarce resource that they have. So there is a lot more that we can do when it comes to education, provide them with material that can empower them to go out there and continue to do this great job that they are doing for our community in Cape Verde, that represents not only our community as well as our families too that are there, so that when they need it, they can find the resource within the community to be the best when it comes to the healthcare, so they can have the same opportunity as every other people in the world have to be the best on their health.